Benjamin Waterhouse. Benjamin Waterhouse was born on March 4, 1754, in Newport, a colony of Rhode Island and Province plantations. He was a physician, co-founder, and professor of Harvard Medical School. He is most well known for being the first doctor to test smallpox vaccine in the United States, which he carried out on his own family. In early life, Waterhouse was born into a Quaker family, although he never adopted the religion as his own. His parents were Timothy Waterhouse, a chairmaker who also served on the Governor's Council, and Hannah Waterhouse. Born and raised in Rhode Island, his medical career began at the age of 16 when he apprenticed for a doctor in his hometown. At age 21, he left the United States to study medicine in Europe at several noble institutions such as with Dr. John Fothergill in London, England. He was also educated in Edinburgh and University of Edinburgh Medical School. Medical career. After returning to the United States in 1782, Waterhouse joined the faculty of the new medical school at Harvard as one of the three professors, including John Warren and Aaron Dexter, in the area of theory and practice of physics. He was also elected the same year as a fellow at Rhode Island College, now Brown University, where he taught natural history. He was elected a fellow of the American Arts Academy of Arts and Science in 1795. In 1814, Waterhouse resigned his Harvard professorship after opposing a plan to establish the medical school in Boston and attempting to found a rival medical school. Smallpox vaccine. Waterhouse was wrote to the then President John Adams, his former roommate, hoping to spread the word about cowpox vaccinations preventing smallpox. When he found President Adams unresponsive, he wrote a letter to the Vice President Thomas Jefferson, a prospect of exterminating the smallpox. Jefferson replied with a letter dated Christmas Day, 1800, and soon offered his support. Once Jefferson became president the following year, Waterhouse introduced Edward Jenner's method of cowpox vaccination in the United States. He attempted to maintain a monopoly over the cowpox vaccine for both financial reasons and to protect the vaccine from incompetent or fraudulent physicians. Waterhouse made the first vaccinations in the United States on four of his children. He commissioned a controlled experiment at the Boston Board of Health in which 19 vaccinated and 2 unvaccinated boys were exposed to the smallpox virus. The vaccinated boys demonstrated immunity and both unvaccinated boys succumbed to the disease. Works like a synopsis of a course on the theory of practice of medicine in four parts. This was written in 1786. The Rise, the Progress, and the Present State of Medicine, which was written in 1792. A Prospect of Exterminating the Smallpox, Part 1 in 1800 and Part 2 in 1802. Cautions to young persons concerning health, showing the evil tendency of the use of tobacco with observations on the use of ardent and vinous spirits, which was compiled in 1805. Information respecting the origin, progress, and efficacy of Kine pox inoculation in 1810. The botanist being the botanical part of a course of lectures on natural history, together with a discourse on the principle of vitality. This is in the year 1811. Finally, ascended. Throughout the 1820s, Waterhouse was a strong supporter of Samuel Thomson's medical system. He died in his home in Cambridge in 1846 and was survived by his wife Lucia. He is interred at Mount Auburn Cemetery, where Louisiana erected a small monument in his honor.